So guys, on today's video, we're talking about PTSD. What is it? I'm going to talk to you guys about what PTSD is. What are some symptoms that, you can watch out for to tell you if you or someone you know might be living with this. And I also want to explain the symptoms a little bit more, because when we don't know why we're experiencing certain symptoms, it can just be that much more stressful. It can make you start to think that maybe you're going crazy when you're really not. So I want to explain to you guys what the purpose is of these symptoms in the first place and how they came to be there. Hi guys, this is your host Nikasha, mental health consultant. This channel is all about mental health, and on each video I give you guys tips on how you can become intentional in your mental health and well-being to achieve the vision you have for your life. So in today's video, we're actually talking about PTSD, post-traumatic stress disorder. What is it? I'm making this video because I've had a lot of clients come into my office over the years saying that they think they're experiencing PTSD, but they're not quite sure because they're not even really sure what PTSD is exactly. We all kind of have an idea, but it can be tough to know, exactly what it is. So that's the point of this video, is to kind of talk about what PTSD really is, clear up any misconceptions, and also give you guys an idea of, if you might have it. So to define PTSD, we're going to have to use the DSM-5, which is the Diagnostic and Statistical Manual for Mental Health Disorders, the 5th edition. So this is something that anyone working in mental health, this is what we use to define different disorders, the symptoms, and all of that. Now, according to the DSM-5, in order to be considered as potentially having PTSD, you would have had to have had direct exposure to a traumatic event. And a traumatic event could be, violence, death, threatened death, injury, something like that. So either have had direct exposure yourself or even just witnessed that happening to somebody else, hearing about it happening to a loved one. And if it's a loved one, the DSM-5 is very clear that it has to be that person, that loved one, experienced it through violent or accidental means. So an expected death would not be considered, or an expected sort of event to a loved one wouldn't be considered amongst that. So looking at some of their other criteria, they also mention something that's really important. They talk about exposure that is experienced by first responders or people who experience traumatic events. It's a part of their job. It's in the course of fulfilling operational duties. So someone who's a first responder is going to have repeated or extreme exposure to traumatic events. And so that's also considered. Something I also want to point out that, makes it more likely to develop PTSD, or for us to even consider an event as traumatic, it's when it happens to us, or we hear about it happening in an environment that we previously thought was safe, we considered safe, and then it occurs there. Like, for example, if something happens at work where you previously felt safe, or even as if you're a student. For example, in the case of school shootings, that can also lead to your perception of something as traumatic and potentially resulting in PTSD as well. Another thing could be if you feel, like the victim of the event is similar to you or similar to a loved one. So, for example, the death of a child who happens to look like your child, or, is around the same age or something like that. Cases like that hit closer to home, and so they affect us a lot more. So now let's jump right into the symptoms. So it says that you have to have at least one of the following intrusive symptoms that's associated with the traumatic event, and it would have had to have occurred after the event. So one would be recurrent, involuntary, and intrusive distressing memories of the traumatic events. And this can actually come in the form of flashbacks. If you find that you're having flashbacks of a traumatic event, that is definitely a symptom of PTSD. So let's say, for example, you were in a major car accident, and when you're driving on the road, let's say you see you're in an accident with a blue SUV, and every time you see a blue SUV, you have a flashback to your accident, or even you smell exhaust, the smell of exhaust fumes, or you know, anything really. You have a flashback of that traumatic event, and when you have that flashback, it's like you're reliving it all over again, and you're having the same anxiety feelings as when you had the accident. So that would be what would be considered a part of that. And it also makes a point of mentioning the fact that children 6 and over may actually engage in some repetitive play. So you may find a child acting out that traumatic event in their play. So let's say, for instance, a child witnessed a violent incident. When they go to play now with their toys, you may see them acting it out. Or let's say they go to draw a picture and they're actually drawing out what they saw. So recurrent distressing dreams in which the content and or affects of the dream are related to the traumatic event. So this is something that you may find happening to you after a traumatic event, and it is a PTSD symptom. So let's say you're a first responder and you witnessed a particular traumatic event. Let's say, you know, a colleague was shot, right? And you're having lots of nightmares about your colleagues being shot and you trying to save them, or you being shot. But let's say, for instance, you were, you know, physically assaulted, or like you were mugged on the street, and now you're having nightmares about that, or about being physically harmed in some way. Intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of the traumatic events. Marked physiological reactions to internal or external cues that symbolize or resemble an aspect of the traumatic events. So it's pretty much the same thing. You know, like the car accident example, right? When you smell a particular scent, like the smell of exhaust, or the smell of, you know, that chemical that's released from an airbag, I'm not even sure what it's called. You may smell that, or something that even smells similar to that. And when that happens, it triggers flashbacks of what happened to you. Triggers can be things like not only smells, but sounds, colors. It can be places, particular environments, people or things, particular objects. So when that thing that your brain has now created as an association, or says it's similar to something that was present during the traumatic event, when you come in contact with that, if you start to have a visceral reaction, like it's almost like you're reliving it, your heart's racing, you know, all those anxiety symptoms start to reoccur. That pretty much fits with what the DSM is trying to say, and that these are you reliving the traumatic event in a way. And you know, it's intrusive. It's not that you're, you know, calling up these thoughts. It's intruding on what you're doing. It's intruding on your day. It's unwanted thoughts that are distressing for you. Persistent avoidance of stimuli associated with the traumatic event, beginning after the traumatic event occurred, as evidenced by one or both of the following. Avoidance of or efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event. Okay, so if you are trying to actively avoid any memories of the event, or avoidance of or efforts to avoid external reminders, people, places, conversations, activities, objects, situations that arouse distressing memories, thoughts, or feelings about or closely associated with the traumatic event. So if something happens to you in a particular place, so let's use the example of a car accident again. If you're avoiding the intersection that car accident happened, or let's say you are a first responder and you respond to a suicide, and you're now avoiding that area where the suicide occurred. Or let's say you were assaulted in, you know, the library, and now you're avoiding going to the library or being anywhere near it, or being around even anyone, a person, or any objects or anything that can trigger for you memories of that traumatic event. So basically, you need to be avoiding either internal stimuli like memories, or external, triggers, external triggers that remind you of what happened to you. Negative alterations in cognitions and mood associated with the traumatic events, beginning or worsening after the traumatic events occurred, as evidenced as by two or more of the following: inability to remember an important aspect of the traumatic events, typically due to dissociative amnesia and not to other factors such as head injury, alcohol, or drugs. So basically, when we go through trauma, and I'll explain a little bit more about that later, there are actually changes that occur. Our brain actually secretes certain hormones that prevents us from remembering the full details of the traumatic event. This is your brain trying to protect you, because those memories are actually very distressing. So there's a reason why people who go through traumatic events actually cannot remember a lot of different details. They may not even remember the sequential order of things. For someone on the outside, they may think this is really odd. Why can't you remember it? This is such a significant thing that happened to you. You should be able to remember every detail, but that's actually not accurate. That's not how the brain works. The more traumatic an event is, the less likely you're going to remember all the details or, even sequence of events. And so basically, it's also wanting to emphasize the fact that it cannot be due to a head injury, alcohol, or drugs. So if you have an accident and you can't remember because of a head injury, that's not really considered a PTSD symptom at that point. And then the other one is persistent and exaggerated negative feelings or expectations about oneself, others, or the world. For example, I am bad, no one can be trusted. The world is completely dangerous. My whole nervous system is permanently ruined. So basically, you would have had to have experienced some sort of change to your world view or your, perception of yourself as a result. So when you've been through any sort of major traumatic event, it's not abnormal to start to question your ability to keep yourself safe. That sense of self-efficacy may be, declining or wavering, or you may start to feel like, the people around you are not able to keep you safe. Maybe, for example, if, you previously thought that your parents were able to keep you safe, or you may start to think that maybe the world isn't a safe place, or if you were assaulted by a friend, someone that you trusted, for instance, you may start to think, I can't trust anybody in this world anymore. Or you may even start to think, I can't even trust myself. Why did I not see it coming? Why did I not pick it up instinctually? Or you may start to blame yourself for what happened. So if you start to have these negative thoughts that come into your mind about yourself or others or the world, that is a symptom as well for PTSD. Persistent, distorted cognitions about the cause or consequences of the traumatic event that lead the individual to blame himself or herself. So pretty much what I was just talking about, if you're starting to blame yourself for what happened to you, or if it's happened to someone else, for instance. So, for example, sometimes when people go through a traumatic event where, let's say they're with a group of friends or loved ones and others die and they live, you may be familiar with the term survivor's guilt. They may start to think, could I have done more? Why am I alive and they're not alive? And they may start to blame themselves in some way. Markedly diminished interest or participation in significant activities. After a traumatic event, it is not uncommon for people to become far more socially withdrawn. It can be difficult to relate to others and have, conversations that you used to have with them when they're talking about things that to you no longer seem all that important. So for example, with first responders, a lot of my clients in the first responder population, they talk about how the estrangement they experience with loved ones, whether it's family, spouses, kids, friends, because they'll have conversations with people and they feel like they can no longer relate. So if a friend is, unhappy with, they didn't get the parking spot they wanted, or they didn't do well in a job interview, for instance, it may be hard to feel that sense of empathy and to relate when you feel like you've seen things that are far more critical, or things that are related to life and death, it can just be a challenge to really feel engaged with others when you're out and about. Or if you are worried about, having like being triggered when you're out in public, or having like a panic reaction, for instance, that could be another reason to be more socially withdrawn. There are varying factors that can come into play, but the point is that it's not uncommon after a traumatic event to become socially withdrawn, or to enjoy things that you previously enjoyed as much as you used to. That loss of pleasure is not uncommon. Persistent inability to experience positive emotions, inability to experience happiness, satisfaction, or loving feelings. This emotional numbing is extremely common for people after traumatic events, especially if they're living with PTSD. Very, very common. That difficulty really feeling a connection to your own emotions, feeling like you can connect to the emotions of other people, just feeling emotionally numb. So out of those 7 things, you would have had to experience at least two or more of those. All right. Now, marked alterations in arousal and reactivity associated with the traumatic events, beginning or worsening after the traumatic events occurred, as evidenced by 2 or more of the following. So now it's going to give us 6 points. Irritable behavior and angry outbursts with little or no provocation, typically expressed as verbal or physical aggression toward people or objects. So I'll give you an example of how that can occur. So let's say you make a minor, or what you perceive to be a minor remark or comment, and the person just gets really upset and just explodes. And to you, they're overreacting. Or let's say you're walking down the street and you bump into someone and they just are livid and just ready to fight you, okay? That is a symptom of this. We call it flat to furious. And I'll explain a little bit more about that as we talk about the whole thing. So basically what happens when you're feeling stressed, and again, I'm going to explain it a bit more when I talk about the stress reaction. When you're going through what we call chronic stress, your body's secreting cortisol, which is a stress hormone. But when you've been stressed for a long period of time, or you've gone through extreme stress, your body determines, I cannot continue to release this level of cortisol anymore. It's not healthy, it's not safe, in fact, it's dangerous. We call it neurotoxicity, where those excitatory hormones, when there's so many of them, they're so concentrated, it actually starts to kill your brain, like it starts to kill neurons, right? And it can't just be killing off neurons. So what happens is your brain decides it's going to start to regulate how much cortisol is released. It's just going to stop releasing them, right? It's going to stop releasing cortisol. And so you go through life pretty much with a flat affect, not really reacting to a whole lot. So you may find that you're emotionally numb, you're not reacting to a whole lot. People around you think that you just kind of have that flat affect. And then what happens is something that seems minor to others leads to a big blow up. And that's because when you're in that that state, we can say hypocortisolism. When you're at that state where your cortisol levels, that stress hormone, is being regulated to where it's like your brain's just not releasing it, right? And you're staying flat. If something does trigger that stress response, you go from 0 to 100. So we call it flat to furious. And that's pretty much what the DSM is talking about in terms of this particular symptom. And I kind of already talked to you guys about, why the brain does this. Our brain pretty much, it's designed to maintain homeostasis, so balance and survival. So anything it does is really to protect us. So obviously that emotional numbing doesn't feel good, but your brain is doing that because it's determined that this is what it needs to get you through, to maintain balance and to survive. So reckless or destructive behavior, that's not uncommon as well when you're dealing with PTSD. So, for example, someone who's the victim of sexual assault may then start to engage in a lot of high-risk sexual activity, or a near-death experience may start to engage in, for example, like reckless stunt driving, where they're driving at excessive speeds, or engaging in drinking and driving, or for first responders who are living with PTSD, it's not uncommon to engage in self-destructive behaviors like substance abuse, for instance.